So good morning friends. This is another session for the keywords to make out the diagnosis easily, and this session will be mainly on the virology. Okay, so first question is petechiae, hepatosplenomegaly and jaundice. Okay, so this is a like triad PHJ. It is usually seen in the cytomegalovirus. So most commonly it is seen in the congenital infection. So if you come across these triads, then it is in CMV. So coming for next question, headache, fever, cervical lymphadenopathy, hepatosplenomegaly, atypical lymphocytosis and rashes following the ampicillin therapy. And these two are the important clues. It is nothing but it is an infectious mononucleosis which is caused by Epstein-Barr virus. So this is a typical history like the patient will be having a rashes after taking the ampicillin, and this is an important point, that is it is usually the clinical lab investigation usually shows an atypical lymphocytosis. Okay, so coming for third question, as you know, the rashes with slapped cheek appearance, and there will be history of any severe anemia or chronic anemia or acute anemia, whatever they can give. It is nothing but it is a Parvovirus. So the important point for Parvovirus is it has a special affinity for the P antigen. Okay, P antigen present in the RBC. So P for P you can remember like that. So anogenital warts. So if you come across any anogenital warts or plantar warts or palmoplantar warts, it is an HPV, human papilloma virus. So another important point you want to remember here is, so this HPV can cause both the benign and the malignant conditions. Okay, so malignant in the sense it is the cervical carcinoma, right? That is it can cause mainly that is caused by human papilloma virus. So coming for next history, it is in children in the summer camp. So okay, how they can give us a child into the summer camp after that develop a conjunctivitis or the red eye, whatever they can give. So or any diarrhea manifestations. If you come across these words summer camp, it is an adenovirus. So adenovirus, you know the important point, it is an space shaped vehicle. Actually the shape is like space vehicle. And another important point is that is it is a cytopathic effect usually shows in the grapes appearance, that is in clustering often grapes like appearance will be there. So next question is pearly white and central amplification. This is the only condition where we will be using an amplification. Microbiology is nothing but it is in Molluscum contagiosum. Okay. So whenever you are coming across a word like a wart-like projection and with central amplification, means it is in Molluscum contagiosum. So another point here is, yeah, you know, it is in bilateral parotitis. Yeah, obviously it is in mumps. Usually in adult they can usually give an epididymo-orchitis also. So this is the second manifestation. This is the first manifestation. So whatever they can give. So here next question is cough, coryza, nasal discharge and spot. The spot is nothing but it is a Koplik spot. So as the name I have given Koplik spot, it is nothing but it is a measles. So this Koplik spot usually arises in the buccal mucosa near the second molar. Okay. So next, maculopapular lash, lymphadenopathy, and then what is a spot? This is nothing but it is rubella. Okay. So in rubella the spot it is called as a Forshamer spot, and then so this is a typical, they can give maculopapular rash or any lymphadenopathies and the spot. And I am sure they won't give a spot name directly. They can have simply the Forshamer spot is seen in rubella, Koplik spot it is usually seen in measles like that. Or they can give like a history, the history of cough, coryza and nasal discharge, and there is a spot which usually appeared in the baby near the lower second molar. Okay, so what is the probable diagnosis? And how you can prevent that? Prevention is nothing but it is a vaccination. So coming for the last question, arthritis, myalgia, hematocrit usually normal. So if it is normal, it is nothing but it is in Chikungunya. Okay. If the hematocrit is increased, and then there is an arthritis, and then there is a platelet count decreased, as you know, it is an important, that is a dengue. So dengue, it is also called as a breakbone fever, right? So you want to remember like this. So hematocrit normal, it is a chikungunya. If it is elevated, it is a dengue. So thank you friends.